Hello. For those of you who don't know me, I am Dr. Laura Pfeiffer. I am a naturopathic doctor with the focus of helping you balance your hormones so that you can focus on what matters. I'm making this short video to talk about how birth control works because a lot of times I'm working with patients who will tell me all of the criteria regarding their periods. So they'll say, my periods come monthly, or maybe they come irregularly, or maybe they're heavy, or they're light, or they're painful. One of my first questions I ask these patients is, are you taking hormonal birth control? And by that, I don't necessarily always mean the pill. I mean anything that has hormones. So that can be the pill, that can be the IUD, that can be the patch, that can be the ring. There are a variety of different types of birth control. So today I'm just going to talk to you about how birth control works, because I want you to understand that when you are taking any form of hormonal birth control, you are not getting a real period. What you are experiencing when you are taking hormonal birth control is actually referred to as a withdrawal bleed. So let's just get into it. We'll talk about the most common types and how your birth control works so that you can actually understand and navigate your cycles a little bit easier. Okay, so let's start with the mechanism of action. Many hormonal contraceptives work on the basis of using hormones to prevent pregnancy. Depending on the specific hormones that we use in that birth control, it's going to happen in a variety of ways. So let's just start with the pill, because the pill is the most common form. And often when I'm talking to women, I'm asking, are you taking birth control? And they'll say, no, I'm on an IUD. Or I'll speak to a woman who is not trying to prevent pregnancy, but maybe she's in a perimenopausal or postmenopausal state, and her doctor has told her, in order to regulate your periods, we have to put you on an IUD. That'll take away your period. And so a lot of these women will come to me experiencing a variety of symptoms. So it could be mood issues, it could be bloating, it could be worsening acne. And we start talking about their period and they tell me they're not taking birth control. But the IUD is in fact hormonal birth control unless you are using the copper IUD. So with the birth control pill, which we're going to just refer to as the pill, it comes in two different types. So we have the first type is a progestin only pill. This is also known as a mini pill. So it doesn't contain estrogen. Often women will be given this one when they are breastfeeding, because you can't give estrogen while you're breastfeeding. And when you're breastfeeding, if you're looking for a form of hormonal birth control, typically the progestin will be the option. Second one is called a combination pill. This contains both estrogen and progesterone. And to be quite honest, the brands vary. The dosages of the actual estrogen and progesterone in these products vary. It really, really depends on what your doctor is probably using frequently, deciding to use on you, depending on if it is, I'm going to put in quotations, working or not. So if you're having spotting between periods, or your symptoms are worsening, or you have any other side effects, your doctor will play around with the dosages. So there are certain brands that have certain dosages of those hormones. And so that will usually determine which one they choose. Typically, the guidance, the recommendation when it comes to birth control pills specifically is to use the lowest effective dose. So what that means is your doctor's probably going to start with the lowest dose birth control and work their way up if they feel that they need to, if your symptoms are not being dealt with. I'm going to make myself a little bit smaller here so that we can read this. Okay. So talking a little bit more about the pill. So mini pills actually work to thicken cervical mucus. So what does that mean? The mucus in your cervix, we see our discharge change throughout the month. And so the way this works, it thickens it to make it harder for the sperm to reach the egg, because we know that in the middle of our cycle, we have an optimal cervical discharge consistency, which is that egg white discharge, that egg white mucus. And that's going to be what facilitates the sperm reaching the egg. And if we have changes in that discharge, that can actually impact it. So this is one way in which the mini pill will work. So when I say that, I mean the progesterone only pill. That's one way in which it works. Also, this can prevent ovulation. So I'll talk about most birth control from the perspective of preventing ovulation, but we also know that with the progestin only, we can have the mechanism of stopping that sperm reaching that egg by way of changing the cervical mucus. Now, I always put the failure rates because this is basically with typical use, how many people will get pregnant in a year kind of accidentally. So the mini pill has about a 7% failure rate within the first year of use, and a lot of people don't realize that it's actually that high. Now, combination pills, like I mentioned, are the combo of estrogen and progesterone. These actually prevent ovulation. This is how they prevent pregnancies. They stop you from ovulating. So again, if you don't ovulate, you don't release an egg, the sperm cannot fertilize the egg. And as you'll see, the failure rates are a lot less, but can be up to 5% with typical use. Now I say typical use again, because this accounts for a variety of things. When we're taking a pill, we have to make sure that A, we take it, B, we actually absorb it and utilize it. And so if you're A, not taking it, so typically we say take it at the same time each day, whether someone is taking medications that may or may not interfere with that birth control, that's going to impact the efficacy of it as well. Hormonal IUD. So your IUD can be hormonal or non-hormonal. And so if your IUD is hormonal, it's probably going to contain estrogen and progestin. Progestin is progesterone, the synthetic form. I want you to remember that. Now, the hormonal IUD, by way of how it works, because it's inside you and it is sending out basically a flatline, consistent dose of hormones all the time, it is one of the most effective from a birth control standpoint with failure rates less than 1%. So this releases hormones constantly and it can stay in place for 5 years, granted that it doesn't cause any other issues. Contraceptive patch is something that's a lot less well known. It contains estrogen and progestin. It's placed on the skin where the hormones can actually be directly absorbed. And it's left on for 3 weeks, taken off 1. Again, it's kind of the same concept as what we're doing. We're giving ourselves hormones and then we're taking them away. This is why you do not have a real period, because what happens is you're being given these synthetic hormones for usually 3 weeks, and then you're being taken off of them for 1 week. This causes a withdrawal bleed, right? This is just your body responding to being given those synthetic hormones and those synthetic hormones then being taken away. And this is why with the IUD, a lot of times women will not get a period at all. They won't really get a withdrawal bleed because we actually have a consistent amount of hormones all the time. Now, some women will get spotting and then that usually resolves, but some women do get a period. Sometimes it's random, sometimes it goes away completely, and that's the reason why. The vaginal ring, also known as the NuvaRing, this is basically the colorless, flexible ring that is inserted into the vaginal canal where it stays in place again 3 weeks, and then we take it out for the 4th week to bleed, to get a period, to get our withdrawal bleed. This again works by suppressing ovulation. Less than 1 in 100 women will be pregnant when they're given the vaginal ring. And then injectables. So typically the most well-known one is Diproprivera. This is actually not recommended anymore, mainly because it is known to lower bone density, which is pretty scary. But this is progestin only. So similar to the mini pill, it is progestin only, but it is injected. So this one works by inhibiting ovulation, and it can inhibit ovulation for up to 15 weeks at a time. So women found it really convenient. The failure rate was super low, but it does have a black box warning that it can increase the risk of osteoporosis. So there is the summary of how birth control works in general. And I really want to draw your attention to the fact that, like I said, birth control does not give you a period. So when we're looking at evaluating your cycle, really, as you can see from me going over all of these pieces, is that most often birth control is stopping your ovulation. When we stop your ovulation, we're not able to cycle our hormones properly because ovulation allows you to make progesterone. When we aren't making progesterone, we aren't balancing our hormones like a typical cycle. A normal menstrual cycle requires us to make estrogen, then we ovulate, then we make progesterone, and then we bleed and we get our period. So I just want you to understand that while you're on birth control, you are not getting a real period. And so the tracking of your symptoms is really just tracking what synthetic hormones are doing to your body. So that is the summary on how birth control works. If you have any questions, please drop them below.